Hello everyone, this is Nicole. I just wanted to go over some amazing updates that are going to be happening within our hospital soon. We have been working very hard on a new electronic healthcare record system, and I kind of wanted to let the staff know about the positives that are about to happen. I know starting a new system is going to be very overwhelming for everybody, and I kind of just wanted to let everybody know about the positives instead of focusing on the negatives at the moment. Like I said, it's going to be very overwhelming for everybody, but if we stay focused and we move forward with the positives, then we can get this up and rolling. The goal is to start the new system in 2019 and have the whole hospital up and running, including our freestanding ERs and all of our rehab and our medical clinics up and running by the end of 2020. So it's going to be a slow, steady process for the most part. We're going to have the managers and directors come in for some training. We've been keeping them up to date with everything, and they will let you know when staff will start training on the new system and when everything will kind of fall into place. The managers and directors will kind of be the super users in the beginning, and they're going to help us get everybody trained and up to date on all of the new systems. The new system is going to be amazing. It's going to have a huge outreach platform that we can speak with patients no matter where they are. If they're on vacation, if they're on the other side of the world, if they have internet access, they'll be able to reach their provider and ask questions, concerns. Their provider, if needed, can write a refill prescription. It basically puts healthcare back into the patient's hands. It's going to make them more responsible for their health. It's going to give them the outreach that's needed for them, and it's our job to educate and let them know what is available to them during this time, and this is a great system for that. We will have social media access. We have people who will be able to monitor our Facebook pages and direct patients in the right direction if they have questions or concerns. Of course, there's going to be a bunch of HIPAA training that goes along with all of this to make sure that we fall within those guidelines that need to keep us safe and keep our patients' information safe. We will be able to help our patients with smoking cessation, let them know about classes that are offering, maternity classes that are offering, birthing classes. Postpartum is rolling out a great program for postpartum depression. This will be a great outreach program for them. There's going to be a support group for that and a Facebook page for that. There's going to be pulmonary rehab and stroke rehab, and there's going to be a lot of support groups that go along with all of this. And it's going to be a great place where patients have information all in one place, so they're not constantly looking or constantly calling, and you'll be able to set reminders for them that this is what's happening. Appointment reminders. Patients will have access to My Chart, which is a great resource for them. They'll have access to all of their labs, their medical history right there, instead of having to call and can you send this to me, can you send that to me. They can see their labs, and if there's any concerns, the doctor can message them or call them and let them know that, hey, this is what's going to happen next. Instead of having the patient call in for the results or sending it by mail, they'll have have more information at their hands so they can do things quicker about it. They can also send physicians or nursing staff questions or concerns, and we'll be able to respond back to them. And if we need them to come into the office, we can set up an appointment right there. It's also a great application because they can set their appointments. They don't have to call into the office and wait on hold and all these other things. It's right there. It sets a reminder for them automatically. They can also write a little note. This is what the appointment's about, so it gives the physician a heads up on how this appointment's supposed to go and what they're coming in for, so they can kind of be prepared and pull records. And it's also great because eventually patients who are diabetic or have high blood pressure, their machines will be able to upload information into their chart, and the doctor will be able to pull that and kind of see trends and make sure that they're following up with their medications, and everything is right there in front of them. So when they come in for this appointment, they can see the trends that the patient's talking about, or if they're being non-compliant, and maybe that's why they are feeling the way that they are and they need a little more education. It's a great outreach program for nursing as well, because it puts all the tools there for you. It has all of the booklets and all of the information that you would need to do the proper education for a patient. For the physicians, it's also great because everybody is busy, and it gives the physician all of the patient information right there. They can look back on the last admission and see if that's reoccurring and what worked for them last time, what didn't work for them last time. They could see x-rays and CT scans that were done at the previous admission. So it cuts back on a lot of the digging time that is needed to figure out previous patient history, which is also great because if a patient comes in unresponsive, we're also able to pull their old medical records without waiting and see what their history is, and see maybe if their blood sugar is too high or too low, or if there's other types of histories of why they would be coming in unresponsive. So it's a really great tool for all the disciplines to be able to interact with each other. The respiratory therapists, they can be able to see previous x-rays, they can see if they have a history of asthma, COPD, anything like that, and they can do proper education that's needed, and everything's all in one place. The nurse can see, oh, respiratory's been educating them on COPD or asthma or smoking. So the nurse can focus on things that are needed, like proper medication, making sure the patient's taking their medication okay, making sure that they're following their diabetic diet, making sure that they understand the resources that are available to them. This is an amazing tool, and it's very exciting to be able to have everything in one place and everybody be able to interact and find the information that's needed in one place. So there's no questions. It's going to cut back on a lot of medical mishaps or close catches, that kind of stuff. It's also hopefully going to help with readmissions, because we'll be able to see the trend if a patient's following their proper medication regimen, or why are they having more COPD exacerbations, and what didn't we do the last time on admission to help cut back on all of this. We'll also be able to reach out to them at home and make sure that they don't have any questions or concerns after discharge, and make sure that they are doing their medication correctly after discharge, because that's where a lot of miscommunication can happen. The patient's just ready to be home. They kind of just brush it off and yeah, it's on the paper. Just let me go home. And then they're not following proper guidelines, especially your surgery patients, making sure that they're keeping their wound sites clean. A lot of this will be able to cut back on by a simple phone call or a follow-up or an email, and making sure that the patient doesn't have any questions or concerns, and if they do, we address it right then and there, so they don't have to come back into the hospital to get something done. It's going to take a lot of teamwork. It's going to take a lot of patience to get all of this up and running, but it will be a great tool for everybody. And we're excited to get everything running, and we can't wait to be able to open so many doors for patients and to let them see what is going to happen and let them take control of their health care, and let us focus on the things that we need to focus on as well. As always, we're going to keep everybody up to date as everything starts to progress. You can always contact your manager. You can contact me. If you have any questions or concerns, it doesn't matter. Just ask, so that way everybody's properly informed on what needs to happen. And we're trying to make this process as smooth as possible. So I'll try and do weekly updates, every 2 weeks, even monthly. It doesn't matter whether it's email, whether it's a video, just something to keep everybody up to date on these exciting times. Have a wonderful day.